Join us now as we mark the World Health Day is a maternal and child health expert, Dr. Benjamin Olowojebutu. He is also the chairman, Nigeria Medical Association, Lagos chapter, and is yet to jackpot as of this morning. Thank you very much for joining us. As of this morning, you are still here.
You have not jackpot.
So we have not just, so you have not left.
Just let's know first. Do you have it? Is it in the works? Are you going to jackpot?
I'm a very patriotic Nigerian.
Is your passport ready?
I have a passport, but I'm not jackpotting.
Okay, great. So now that we know that you are here with us as of this morning, because anything can change between this morning and after. What are your thoughts? Because I mean, it's still the celebrated World Health Day, May 7th. No, April 7th.
April 7th, yes.
And it's a day where we just reflect on the status of our health in our country. Just before you came in, we're talking about medical tourism and the National Assembly trying to stop or get a bill to reduce that. In your view, as a practicing doctor and a patriotic doctor who lives in Nigeria for now, what are your thoughts on where we are medically and how do we begin to improve?
I think we have moved forward a little bit.
Okay.
We have also moved backwards more. Because we are very reactive in Nigeria. We are not proactive. I remember the Ebola, when Ebola happened years ago, when we lost a very, very important medical doctor, a senior colleague, Dr. Adadevo. We didn't learn the things from Ebola. Because then COVID came again, we had to do the same thing over again. As a nation, I think we should have an important disaster management policy that helps us think about not just waiting for it to happen, understanding how this process happen. I'm glad that Lagos is already doing something about biosecurity and thinking about expecting research on how this evolves. Because if there's a viral problem, there can be another one in the future. You know, so but maternal health indices, we are still having some issues about increased maternal mortality, about infant mortality, as the case may be. But we have started having health insurance. In 1999, we started national insurance. There was a problem between me and Shell. But now, thank God, last year, it was not signed into law about NHI. It's now NHI, National Health Insurance Authority, that makes sure that every Nigerian that is breathing the air in Nigerian soil must have health insurance. I think it's good, but have we popularized it enough? No. Do people know about it? No. Do people understand what it means to have health insurance? And some very, very important ailments are not covered by health insurance, like cancer treatment. You know, cancer doesn't affect only the rich people again. It's affecting even the very, very poor people, and they cannot afford health care. They turn into prayer session, or they go to mosques and say it's about a spiritual problem because they cannot afford the health care. So for me, we have done well in some areas in healthcare. You know, we're having better diagnosis tools now. We're having better access to healthcare. People are asking better questions. There's better communication by the healthcare force. But the value of healthcare as owning it as a nation, we've not gotten there. I usually say a few things. If the government wants to be good government, they should own the system, own it. So, which means that if you say, I want to fix healthcare in Nigeria, I want healthcare that's obtained in Nigeria be my own resource. So if I have a headache, or I have an ear pain, or I have mouth pain, I don't jet out of Nigeria. I stay in that same country and I use the same health facility and I get it.
Which the vice president when he was sick.
That's it. Yeah. So the point is, we have not owned the process in Nigeria as leaders. We have not owned it.
All right, I wanted to follow up on something you said before I go to the ladies. You said something about Ebola, because I would have begged to differ a bit. I want you to give me clarity.
Okay, go ahead.
Because I know that the Commissioner for Health has been here. We've had a few people come that we learned from Ebola. That even when COVID came, we were better prepared because we had quite a few of all these, what they call those centers, those isolation centers already available. So we didn't catch us unawares. That's one. I'll come back now. I'll come to you.
Okay. And
even more recently, the Lasuth CMD was saying that the accident that happened with the train tracks didn't really catch them unawares because they're able to, there's a daily dry run of emergency. So some lessons were learned from those few experiences. Do you agree or disagree?
So the point is, COVID is what has learned now.
Yeah.
Ebola, we didn't domesticate Ebola's learning, but maybe because the Ebola was very hemorrhagic, but this COVID has helped us because now I know in Lasuth they do drills of emergency drills now, but we didn't have that before COVID.
Okay. Just to clarify.
Yes, that's what I'm saying.
Go ahead.
So let me throw in a question, because when we talk about, we've been discussing health all through today, even from yesterday, and it's a major issue because you don't have a country, there's no economy without your healthcare covered. And all of us on the show, BC will throw it in regularly that the politicians should use Nigerian healthcare sector. The first law they should pass if they want change in the health sector is to make it compulsory for them to pursue healthcare here. It is not, it will require a very high level of patriotism and sacrificial patriotism for them to pass that law. Wow. I don't see that happening anytime soon. So why don't we go into short wins, small terms, the small things that we can knock off. Can you be more realistic in your expectations of our politicians in implementing the health sector? They are quick to doing infrastructure because you can point to, I built the biggest hospital in this Kiniko. But outside infrastructure, what would you say are key areas that are being overlooked within the health sector that, if implemented, will cause a major improvement in the life of Nigerians? Let
me give a very simple scenario. What happens in developed world? Why is everybody going there? It's because they have a very, very strong PH system, permanent care system. I'm sure you live in an area, you don't know, I'm sure you can't even see where the PH hospital is. So for me, the local government must be very responsible. So this dichotomy between local government autonomy, state government autonomy, federal government autonomy, sometimes the focal point of the states of a particular, of the state executive doesn't align with the focal point or the thought process of the local government. So there's a disparity. Yeah. The local government, they don't own the PHCs. And one of the focal points for PHC is community participation. Yeah. So if you don't own it, somebody that has malaria and typhoid will now leave his house in Ketu and go and stay in Ikeja.
But in Lagos is not an example, because I know for a fact that Lagos PHCs are working.
Yes.
They are. People are using them.
I'm saying
parts of Nigeria.
Primary health.
Okay. What I'm saying is that they are working, but how much popular are they? We need to make them very popular so we don't overflog our big general hospitals, our teaching institutions. Lagos is doing well. But if you look at other states, you have barely maybe one doctor. I remember I heard a story last 2 weeks about a doctor in one local government in Nasarawa, one doctor. In your local government, one doctor. Hey. So now look at the influx of and there's urban growth. No doctor wants to, no healthcare worker wants to work in rural community anymore. They wants to come to Lagos or come to Abuja where the money really is. You remember that we had this MSS stuff back in some few years ago, midwife scheme scale. Yeah. Where you have retired midwife go to villages, rural communities to treat people that have treat antenatal patients and get them delivered. But what has happened now? Boko Haram happened. They ran away. Bandits happened. They ran away. So people, there's no protected. Their lives are not protected. So for me,
go ahead. This is my own problem with your profession, the healthcare system in Nigeria. Okay. Everyone that is sick has typhoid and malaria.
That's not true.
That's the first diagnosis.
Before they start to treat you for typhoid, you might have something that if they diagnose it now can treat you. Instead, they will just allow the person to die because everybody has typhoid. Why I'm saying this is a staff of mine is ill. Well, staff of someone I know is ill. And they are treating him for typhoid and malaria, and this guy is not getting better. And I'm actually worried. So what are we going to do about typhoid? Because I know that typhoid is only if you go and drink water that you catch typhoid. But everybody now has typhoid.
So
it's the most common, so they have to eliminate.
Malaria is very endemic. We live in very, our environments are very poor hygiene and everything. But there are diagnostic tools to know malaria or typhoid. The point is this. Proper history taking is very important in getting the right diagnosis and testing to be done to be sure the patient has this or that. But as I say, it's very common. People see malaria because it's what, and a lot of people in Nigeria too, as patients, want to hear, they say I get typhoid, they say I get malaria. Even before you go to the chemist, they tell you, Oga, Be like say I get malaria. Okay, be like say I get
It's like abroad, they think they have flu. Flu is like the most
yes,
common
flu,
thing.
yes.
Everybody, so we don't treat you for flu first.
it's
After it
common.
persists, they now...
Yeah, that's it.
No,
the
they
point.
don't.
Yeah,
They don't.
So the point is this. The point is this. They tell you to do your personal hygiene, steam yourself, take paracetamol. Then if it persists, see a doctor.
Well,
So
how do we have history when the doctor that treated you yesterday has jackpot today?
Okay, that's a different conversation. The conversation I want to say, because I like and I know that this my... Don't pinch me up, because this is about you. So I like you to comment on this.
Okay.
My problem with those who always say that they must change the law, that all politicians' children must not live abroad or they must not school abroad. And I'm thinking to myself,
You don't
they
like
must
the
not
law?
use medical services abroad. They must be treated in Nigeria. And I'm thinking that wouldn't solve the problem. I think what would solve the problem is there's a bill where once you earn a certain amount of salary, maybe 500,000 naira, 100,000, 1 million naira a year, you shouldn't be allowed to travel abroad, even if you're a private citizen. Because the truth is that we as a people, we need to start being patriotic and say, do you want to fix this country or do you want to fix it?
I agree with you.
Because if everybody who is able to afford X amount of million, that means you have a good house, you have a decent car, don't travel abroad because you have headache. Stay in Nigeria, because if all of us who have some money stay here to support, and maybe you have a philanthropy, that your money, you want to go and buy a yacht, you want to go and buy a London house, use it to maybe build a hospital or to invest in Nigeria. Maybe you won't have all these doctors jackpotting.
I beg to differ a little
Please.
bit. Let me
A little bit.
Please,
I'm waiting for you.
Let me see. The guy that works very, very hard and thinks about his economic trivialities in this country and makes money,
Yes.
and you tell him to stay in the country. But these politicians use our tax,
That's the
our hard-earned tax, and they get fat.
All of these
Hold on a bit.
benefits.
Somebody, a lawmaker, a rep gets about 30 million a month as salary, basic
Where did
salary.
you get that data from?
30 million basic salary and allowances and going forward. So not even a doctor earns that money in a year. You now say that somebody that works very, very hard
for his money.
for his money. No, so for me,
Right.
there should be regulation to how our taxes are spent.
That is it. Of our
It's
tax.
very, very
How
key.
many of us are paying taxes?
Our oil money is our own.
Let me,
Oil money is there. Oil money is there.
Moriah, hold on.
But
Moriah,
Nigerians, are they paying
Moriah,
taxes?
hold
Yes.
on.
Yes, paying taxes. You that are working. you're paying.
Moriah, hold on.
Yes, please.
What about the VAT tax? Everybody pays that.
Yes.
Everybody.
When you shop in
Everybody.
the supermarket.
Let me shock you now. There's a tax called SSB tax. Sweetened sugar buried taxes.
Whoa.
All of us are paying it.
I ain't
We're all
trying
paying
to
it. Now, some energy drinks have 40 cubes of sugar. Some sodas have 20 cubes of sugar. And for every sugar you eat, they pay SSB tax. We all pay it.
We
because
pay tax to kill ourselves.
Yes. to kill
Doctor,
ourselves.
do you realize the hospitals you go abroad are not being, they're not by government. It's private people like you who died and leave their property. Okay, you know, my children, we're going to build this. And many schools you attend abroad, it is private philanthropists
Yeah,
who have
but-
sponsored. So
because-
Mariah, we're not
somebody
abroad.
as a citizen
Mariah.
must be patriotic enough to say, this is my money, oh, hand it over to government.
Let's hear the
Please, I'm not
doctor.
spoken.
Let me-
I'm not asked a question here. We are not.
I'm just telling you that
Mariah,
Nigerians must begin to take
No.
responsibility.
Mariah,
Also,
hold on.
for the development of this country.
Yes,
Mariah.
we are not abroad. That's one. The basic amenities that they have there, we do not have it. So
Correct.
it's an unfair
Comparison.
comparison.
Correct.
When you want to say because they are doing this abroad, you are doing that. So that's one. Wait, secondly, if you choose to lead, if a private individual, I'm not saying you should stop whatever you're doing. It's your money, you're working for it. If you choose to lead, you must set examples. You must own, I like the word you use, you must take ownership
Of the process.
that
it.
you want developed.
Yes.
And one of the ways to take ownership is to be a part of it. You cannot have access to travel out and then you are sorting issues for people who do not have that
100%.
access. You will not be involved. And that is where we are seeing where the issue
Don't
is.
wear the shoe.
They are not involved. They
Don't
don't
know
wear
where
the shoe. They don't
it's
patronize
How can you-
hospitals. You cannot make any meaningful change because you are personally not involved.
How can you
So
say-
own the process.
How
That's
can you
it.
say you want to rule Nigeria or lead in Nigeria?
And you're living
then
in another
you are-
place.
Every time you are sick,
You cough.
go
You
abroad.
travel out.
Then
Private jets.
Your citizens cannot afford it.
Why
Then wait. Another person, Tokpa is now making her own money and she wants to go. You say she
cannot go.
But I,
Patriotism.
but you,
That's not, no.
She's
Hear me
saying
out.
to cover
I'm saying everybody, both
No,
the
no, no.
politicians.
Let the
Hang in
leaders
there.
start.
I've made you talk.
Let
Both
the
the
leaders
politicians
start.
who we have selected, who we have elected, and those of you who are rich.
me.
There's a certain level
Let
of
the
wealthy
leaders
Nigerians who too should be restricted.
They cannot
not to
be
leave this country.
restricted.
They must be
That's
restricted.
not
Let's
Why-
hear our
why
doctor.
doctor? You
Doctor,
cannot be
doctor.
appeal.
You
You
don't
restrict.
resolve. Let us hear our doctor.
Let's ask her a question.
Ask her.
I'm not your guest.
No, you are the guest today.
No, I'm not talking now. So we must ask you this question. Why should they be restricted?
Exactly.
Why do you think that if I'm not earning money from government, I'm making my own personal money?
Let me answer
why
that question.
should I be restricted?
Providing all the amenities that you need by yourself.
Because these people are possibly like, what, 1%? Hanging there? 1%, the politicians, add all of them together.
Add their money.
1%. All that money together is not going to build you the amount of hospitals you need.
It will
No, it won't. It won't build the amount of hospitals you need. The amount of schools you need, it wouldn't build it. What we need is all of us, all hands on deck. Because if we are first in Nigeria and say, you know what, I want to support this country in my own way, as a philanthropist or somebody who is very rich, I built these companies, it's my time to say 10% of my profit is going into this.
I'm already paying
10% of your profit have you put already?
Moriah,
Yes.
Thank you. Can I shock you a little bit?
Please shock us. Please shock me.
Now, you use taxpayers' money without recourse to the taxpayers. You don't think about them. That's first I talk about love for country.
Hey, a billionaire from
Love for country. The country made you. You take people's money and you are able to just live without any thinking. It's sad.
sad.
Now, if you say that you want to fix this country, let me give you a scenario. If you want people to stay back in the country, fix the country.
Simple.
It doesn't take a lot to fix the country.
At all.
Make
Dedication.
power available.
Yeah.
Tell people and say, I, as the leader of this local government, I would not leave this my hospital, PHC.
I'll use here with
I'll
you
use
guys.
here with you guys, and we'll make it available 24 hours, 7 days a week, and we'll see ourselves
You will
prosper.
see the changes.
Okay.
It's important
Fantastic.
we own the process
Own the
as leaders.
process.
Lead
Not
by
talk.
example.
They have to run.
That is like
Own the
leadership by
process.
example.
Yes.
Not leadership by proxy.
By proxy.
Point
By
taken.
example.
Or by
That's a
punishment.
very valid point.
Yes.
Thank you, Dr.
You are rich people.
Olowojebutu, for joining us this morning. That's all we can take on today's show, or just a conversation.